Telestroke programs enable the delivery of rapid, time-sensitive treatment for acute stroke in rural regions of the U.S. The vast Virginia Acute Stroke Telehealth Program, demonstrated today, is one of the most advanced telestroke programs in the country. The program coordinates care across multiple remote locations using a wide array of health information technologies. Radio frequency paging systems for rapid alerts, broadband internet connection to facilitate image and data transfer, high-definition camera with remote zoom for high-resolution image acquisition, high-quality video conferencing equipment for live interactive consultations, picture archiving communication system for radiology image viewing, remote access to patient electronic medical records, integration of the remote patient monitoring system for chronic disease management, secure health information exchange in development with federal and state partners using the National Health Information Network. This demonstration follows the story of Mr. Richard Davis, a health-conscious 67-year-old Army veteran. A native of New York, he retired to rural Western Virginia from an urban setting. As often is the case, his stroke strikes rapidly and with little warning.
Yeah, Jenna, I'm just tired of it. I'm just tired.
Richard!
Bath County 911, what's your emergency?
A man has fallen. Bill!
With stroke, time is of the essence. For every minute that goes by, Mr. Davis's clot causes more permanent damage. A clot-busting drug called TPA, when administered within 3 hours, will increase his chances of complete recovery by 30 to 50%. But there's a problem. His tiny town of 2,500 is far from any major medical center, and the clot-buster drug requires advanced diagnostics before it can be administered. Mr. Davis is fortunate. Now, because of new telehealth technology made available through the VAST pilot program, there is a life-saving stroke treatment just down the road. Mr. Davis is rushed to the Bath County Community Hospital emergency room. The on-call ER physician, Dr. Freed, obtains the critical history and performs a quick examination.
I'm going to do a couple tests.
Okay.
Any trouble breathing?
No.
No trouble breathing. Okay.
Dr. Freed recognizes the signs of stroke, and his staff initiates the call to the UVA Stroke Telemedicine on-call team. He sends Richard for a head CT scan to obtain vital images of his brain. These images are rapidly transmitted electronically to the UVA Picture Archiving and Communication System, which allows the on-call physicians to access high-resolution diagnostic images from virtually any location. 150 miles away on this Saturday afternoon, Dr. Solinsky's pager alerts. She logs onto her home computer to connect to the Bath Hospital ER.
We work closely with Charlottesville, with the neurologists there, the stroke specialists, and they're going to be coming through on this television screen. Dr. Solinsky is the doctor on call, and so she's going to be asking you some questions and giving us some direction on whether to go ahead with this medicine.
Okay.
Within minutes, she is conducting a live two-way audio-video conference with Mr. Davis and the Bath County Community Hospital staff. On a second monitor, she interprets his head CT scan to ensure there is no brain hemorrhage which would prohibit treatment with TPA. She rapidly accesses his UVA electronic medical record and the continuity of care document from the Veterans Administration using a clinical health information exchange interface currently in development. She reviews all the data to ensure the drug can be safely administered. Dr. Solinsky performs a standardized neurologic examination, the NIH stroke scale, while manipulating the remote camera. She explains the risks and benefits of treatment. With the benefit of this highly coordinated consultation, Mr. Davis is administered TPA intravenously well within the 3-hour therapeutic window. Mr. Davis is airlifted to the UVA Neurointensive Care Unit for close neurological monitoring.
That's much better. Good improvement.
Following an excellent recovery, Mr. Davis returns home where he will receive physical, speech, and occupational therapy along with remote monitoring. His UVA medical records are sent to his primary care physician. 1 week later, Mr. Davis's life begins to return to normal. However, during his hospital stay, he learned that his high blood pressure was not well controlled. Back home in Hot Springs, the home health monitoring device alerts him to take his blood pressure.
How are you feeling today compared to yesterday?
I'm the same.
Put the blood pressure cuff on your arm
Okay,
as
well, would you help
shown.
me with the blood pressure, please? Just pull it tight. All right.
Rhonda, his home health nurse, notes that Mr. Davis is in need of additional counseling and video conferences with him in addition to notifying his physician.
Hi, Mr. Davis. How are you?
I'm fine, Rhonda. How are you today?
I'm doing very well. I see you just did your health session, and we got some of your data.
As a result of this encounter, Mr. Davis's antihypertensive medications are adjusted considerably earlier than might have been the case without remote monitoring. This video illustrates the successful integration of health information technologies throughout the entire continuum of stroke care. Broadband and wireless communication services, radio frequency paging systems, high-definition video conferencing technologies, picture archiving communication system, electronic medical records retrieval, and remote monitoring systems all contribute to the delivery of high-quality care.